So this is my video assignment for HENT for week 3 requirement. This will be my patient for this video presentation. And hello Suzanne, do you consent for this video to be taped for education purposes for the requirement for this program?
Yes.
Hello, my name is Reagan May. I'll be a nurse
Hi.
practitioner student for this exam. I believe you're here for your wellness.
Mm-hmm.
And we will do your HENT test. So for your HENT, we will start with your head, eyes, ears, nose, and then throat. So we do inspection. So you check for the hair distribution. Any cysts or any bumps going should be noted in the chart. The next one is your eye check. You ask the patient for the visual acuity using the Snellen chart. Ask the patient to hold with one hand and then cover the other eye with your other hand. So read the smallest letter you can see from this chart.
LTFPH.
Okay, thank you. And then using the other hand and cover your eye.
LTFPH.
From the inspection, you check for the outer eyes. You note for sclera, the sclera, the conjunctiva, and for any discharge or any discoloration. You look straight, and then you check for your lower conjunctiva. Look up, make sure it's pink, and then note for any hordeolum or anything that's in the cyst is going. Look straight. And look up. Now you're checking for the lacrimal glands. The next one is you need to check for the pupil reaction to light, so directly and consensually. So you look straight and then check here. So this one here is reactive to light. So ask the patient to put one hand straight. So you're checking for the consensual, which is this will constrict. And thank you. Next one is you check for the cranial nerves number 3, 4, and 6, which you do your you ask the patient to follow the tip of your pen light with your eyes. You're checking the visual fields of your patient, and then the last one is the nystagmus test to check for the eye movement. Next one is you check for the peripheral vision of the patient. Look and tell me when you don't see my finger anymore.
I don't. I see or I don't?
You see my finger.
Yeah.
Look straight. Tell me where you see my finger.
Yeah, on the side. I can see it on the side.
From here, can you still see it?
Yeah.
Okay. How many fingers do I have?
I can at
Okay.
2.
Okay. And ophthalmoscopic exam is you use the ophthalmoscope. You check for the red reflex by asking the patient to look straight, and then you check for the magnification. From the red reflex, you check for the inner side of the eye. And then you check for the optic disc, fovea, and then the macula. And you will do the same thing in your other eye. For the nose you inspect for the outer part of the nose, the symmetry, and then with the source of light, you check for the internal mucosa. And then you check for the turbinates if it's not swollen. That's the inspection. And then you ask your patient to check for the smell with covering with one eye, closing the eyes.
Covering one eye?
Close your eyes and covering one of your nares. Tell me, what do you smell?
Coffee.
And then cover the other side. What do you smell?
Coffee.
And check for the ears. You check for the hearing acuity, which you ask the patient to cover one ear, and then whisper test.
Notebook.
Okay, and cover the other side.
Notebook.
So with the thalamuscope,
Otoscope.
with the otoscope, you inspect the inner ear, and then you're checking for the tympanic membrane. It should be at least pearly white, and then you check for the light reflex. For adult, you check up and backward. Make sure it's not bulging, or no, it's not red. And then you change this this scope, and then you check again the other side of the ear. On the external part of your eye, you check for the discharge. You check for any inflammation or any further smell for pus. Now for the mouth and throat, you inspect the lips and then
Weber's test.
Well, before we go that, we need to check for the Weber's test. Ask the patient if you can hear the sound. You hear it?
Mm-hmm.
Can you still hear it?
Mm-hmm.
Tell me when you can hear it.
No.
Okay, and then you check for the Rand's test, the air and bone conduction. Can you hear it?
Yes.
Tell me when you can't hear it.
Mm-hmm.
Can you still hear it?
Yes.
And then you do the same on the other ear. So now we'll proceed with your mouth, nose, and throat. So inspection of the lips, you check for the outer lips and then the oral mucosa. Open your mouth, tongue out, and then from here you're checking also the uvula, the tonsils, and then using a tongue depressor, you press down and press side and the left side. So you're checking for the cranial nerve number 9 and number 10. Range of motion for the neck, you check for the preauricular lymph nodes.
Range of motion.
Oh yeah, range of motion is when you ask the patient turn left, turn right, hyperextend, and then flexion. And then the shrug test. So now you palpate with the lymph nodes from the preauricular, postauricular, submandibular, submental, anterior cervical, posterior cervical, and occipital. Then the subclavicle and infraclavicular. You note for any swollen lymph nodes or any tenderness. That's it. That ends my video for this presentation. Thank you.